Dear students, in lifestyle diseases and prevention subject, today we will discuss the next topic from unit number 1, diabetes mellitus. So in this topic we are going to see what is meant by diabetes mellitus, what are all the major symptoms of diabetes mellitus, what are the major risk factors associated with the progression of diabetes mellitus, effects of diabetes mellitus, types of diabetes mellitus, and treatment and prevention of diabetes mellitus. We will discuss all the informations in this flow. First, we will start from the beginning. Okay, right. What is meant by diabetes? Diabetes mellitus is a group of diseases characterized by high levels of blood glucose resulting from defects in insulin production and its action, or both. The term diabetes mellitus describes a metabolic disorder characterized by chronic hyperglycemia with disturbances of carbohydrate, fat, and protein metabolism resulting from defects in insulin secretion, insulin action, or both. The effects of diabetes mellitus include long-term damage, dysfunction, and failure of various organs present in the human body. Okay, right. In general, diabetes mellitus may present with characteristic symptoms such as thirst, polyuria, blurring of vision, and sudden weight loss. In its most severe forms, ketoacidosis state may develop, and in absence of effective treatment and death. Okay, often symptoms are not severe or absent. Hyperglycemia alone is sufficient to cause pathological and functional changes before the diagnosis is made. The general symptoms of diabetes mellitus: always feeling tired, frequent urination, that is polyuria, always hungry, sexual problems, sudden weight loss, wounds that won't heal naturally, vaginal infections, numb or tingling hands or feet, always thirsty, and blurry vision. These are all the major symptoms of diabetes mellitus. All of us will have a common question: does sugar cause diabetes? Okay, let's see the answer. There are a lot of risk factors that have been characterized well for the cause of disease diabetes mellitus. That includes generally family history, lack of physical activity, unhealthy eating, and overweight. All of us, we know very well about the major types of diabetes mellitus, that is type 1 and type 2 diabetes. We have distinctive risk factors for type 1 and type 2 diabetes mellitus. For type 1 diabetes mellitus, family history has a very important role for the progression. But in case of type 2, overweight or obese is the first and prime risk factor, followed by blood pressure, which is higher than the routine 80 to 120 range, then abnormal cholesterol level, that is those who have the cholesterol range of 35 or lower, that is HDL, in terms of HDL, or higher triglyceride level, that is 250 milligram or above. The next risk factor is lack of physical activity, gestational diabetes, and those who are 40 plus age are highly susceptible for the development of type 2 diabetes mellitus. So these are all the major risk factors for type 1 diabetes and type 2 diabetes. In Americans, 29.1 million individuals are diagnosed with diabetes mellitus, and 1 out of 4 of them are having diabetes issue. Okay, what are all the major long-term effects of diabetes? Now we'll discuss it. Okay, the first one is retinopathy, vision problem. Okay, So retinopathy with a potential blindness is the first and prime long-term effect that is happening due to diabetes mellitus. Second one, nephropathy that may lead to renal failure. Third one, neuropathy with the risk of foot ulcers and sexual dysfunction. So these are four are the major long-term effects that have been characterized well in association with the diabetes mellitus. Apart from this, people with diabetes are at increased risk of cardiovascular, peripheral vascular and cerebrovascular diseases. Okay, the long-term complications of type 2 diabetes mellitus may affect the major organs of the human body that includes heart, brain, leg, eyes, kidney. So these are all the major organs which will definitely affected due to the unattended diabetes mellitus case. Apart from this, teeth will also get some suffering due to diabetes mellitus, that is called gingivitis. Okay, then while considering the major complications of diabetes mellitus, heart disease, stroke and hypertension occupies the top positions in the chronic effects of diabetes mellitus, followed by the nervous system disease, blindness, dental disease and complications in pregnancy. So the major complications of diabetes mellitus can be listed in this order. Okay, International Diabetes Federation, that is IDF, data indicate that by the year 2025 the number of people affected by diabetes mellitus will reach 340 million. Okay, in this 90% of the people will have type 2 diabetes. Okay, in most Western society the overall prevalence has reached 4 to 6% and it is as high as 10 to 12% among 60 to 70 year old people. The annual health cost by diabetes and its complications account for around 6 to 12% of all healthcare expenditures in most of the countries. Then we will discuss what are all the major types of diabetes mellitus. We know very well diabetes can be differentiated into different types, in which type 1 diabetes mellitus, that is also familiarly known as insulin dependent diabetes mellitus, that is IDDM. The second one is type 2 diabetes mellitus, which is known as non-insulin dependent diabetes mellitus, that is NIDDM. Third one is gestational diabetes. These three are the major types of diabetes mellitus that everyone knows. But other than this, there are so many varieties of diabetes that have been characterized among scientific people. Okay, that includes MODY, maturity onset diabetes of youth, secondary diabetes mellitus, type 1.5 diabetes mellitus are the other varieties. Okay, we'll discuss about all these types one by one. If we take a look on the diabetic people, 90% of the individual will have type 2 diabetes mellitus and the rest of the people will have type 1 diabetes mellitus or other types of diabetes mellitus. This is a scenario universally. Okay, type 1 diabetes mellitus, it was previously called as insulin dependent diabetes mellitus or juvenile onset diabetes. Type 1 diabetes develops when the body's immune system destroys pancreatic beta cells, the only cells in the body that make the hormone insulin, which regulates the blood glucose level. Okay, this form of diabetes usually strikes children and young adults, and although disease onset can occur at any age. Type 1 diabetes may account for around 5 to 10% of all the diagnostic cases of diabetes mellitus. The risk factors for type 1 diabetes may include autoimmune problems, genetical aberrations, and environmental factors. The pathogenesis of type 1 diabetes mellitus. Initially, there are a lot of factors which are acting as the prime reason for the progression of type 1 diabetes mellitus. That includes autoantigen, genetical factors and environmental factors. Okay, any one of them initially may activate the T helper cells in the body. The activated T helper cells will release excess of cytokines that includes interleukin 2 and gamma interferon. The released interleukin 2 and gamma interferon will cause the problem of inflammation of beta cells of pancreas, that is called insulitis. Okay, that is decline in the production of insulin. The production rate of the insulin will be reduced, that is called insulitis. Sometimes the inflamed cells may lead to death, that is the beta cells of the pancreas will be destroyed completely so that the body will fail to produce the insulin. This condition leads to the failure in the management of blood glucose that has been taken through diet or released due to the metabolism by other body cells. Okay, this is how the type 1 diabetes mellitus is progressed in the human body. Second one, type 2 diabetes mellitus. It was previously called non-insulin dependent diabetes mellitus, that is NIDDM, or adult onset diabetes, which account for about 90 to 95% of all the diagnostic cases of the diabetes universally. So this is the most familiar form of diabetes among the individuals. It begins as insulin resistance, a disorder in which the cells do not use insulin properly, and the pancreas gradually loses its ability to produce insulin. Type 2 diabetes is associated with older age, obesity, family history of diabetes, history of gestational diabetes, impaired glucose metabolism, physical activity, that is lack of physical activity, and sometimes race and ethnicity will also act as the major risk factor for the type 2 diabetes mellitus. This type 2 diabetes mellitus is increasingly being diagnosed in children and adolescents recently. Initially, it was believed that type 1 diabetes mellitus alone will affect the children and adults. That is why it is said to be juvenile onset diabetes. That is, type 1 diabetes is also known as juvenile onset diabetes since it affects only children and young people. But in recent times, this statement has been broken by the scientific community that type 2 diabetes may also affect children and youth. Okay. While discussing the pathogenesis of type 2 diabetes mellitus, there are a lot of factors behind it. Okay, that includes genetical factor or environmental factor. Okay, first we'll discuss about the genetical factors. This genetical factor may cause two different problems in the body. Number one is due to the family history or the genetical aberration, it may directly fail the beta cells to produce insulin naturally. Sometimes the genetical reasons may cause insulin resistance in some cells. Okay, these two are the major problems caused by the genetical factors. Okay, sometimes environmental factors may also cause insulin resistance. Environmental factors in the sense excess of energy that has been taken through diet or the sedentary lifestyle practices what we follow in our lifestyle. Okay, so these two are said to be the major environmental factor that can cause the insulin resistance problems in the individuals. So the insulin resistance problems may be caused either by the genetical factors or the environmental factors. Okay, once the insulin resistance has happened in the body, it triggers the rate of free fatty acid level in the human body as well as free glucose. So the level of free fatty acid and free glucose will be raised, and this condition may even cause the problem of obesity. Okay, once obesity and glucose levels are getting elevated in the body, the insulin resistance will lead to the next condition called impaired glucose tolerance. the body will fail to utilize the glucose present in the circulation. That is called impaired glucose tolerance. The body cells will fail to tolerate the glucose present in the blood. Okay, that condition leads to the ultimate end, type 2 diabetes mellitus. Okay, so either direct failure of beta cells by the genetical factor or by the environmental factor may cause type 2 diabetes mellitus. Otherwise, the insulin resistance induced by the genetical factor and environmental condition may cause the problem of impaired glucose tolerance, which results ultimately in type 2 diabetes mellitus in the individuals. This is about the basic pathogenicity behind in the type 2 diabetes mellitus. In our body, there are two different hormones called insulin and glucagon having a very important roles for glucose homeostasis, that is the maintenance of body blood glucose. And both the hormones are released naturally depends on the blood glucose level. Whenever the body blood glucose level is higher than the optimal condition, immediately the beta cells of pancreas will release insulin. This hormone will trigger the muscle cells and liver cells to utilize the excess of glucose present in the blood. Okay, ultimately the blood glucose levels will start to reduce and they may be stored in the form of glycogen in the liver tissue or in the muscle tissue. This is what will happen whenever the body releases excess of insulin when we have excess of glucose in the blood. Suppose the blood glucose is very low in the circulation. What will happen? Immediately the pancreas will release the insulin antagonist hormone glucagon. The ultimate function of glucagon is to increase the blood glucose into normal level. That is the main function of glucagon, okay, which is functions like an antagonist to insulin. Insulin's role is to decrease the blood glucose into normal condition. Glucagon's role is to increase the blood glucose into optimal condition. Okay, that is it. So when we have very low blood sugar, glucagon will be released by the pancreatic cells, that is particularly alpha cells, okay, and it triggers the conversion of glycogen that has been stored in the liver into free glucose. That is glycogenolysis process will be triggered by the hormone glucagon, so that the free glucose will be liberated excessively by hepatic cells into the blood. Obviously, the level of the blood glucose present in the circulation will be raised into normal condition. So this is how far the body is maintaining the blood glucose level into normal condition whenever it is either low or higher than the normal level. Okay. The third type of diabetes mellitus is gestational diabetes. Very interesting one. It is a form of glucose intolerance. This is not actually a pure diabetic variety. Okay, it is actually a form of glucose intolerance that is diagnosed in some women, particularly during pregnancy. Gestational diabetes occurs more common among obese women and women with a family history of diabetes. Okay, during pregnancy, gestational diabetes requires treatment to normalize maternal blood glucose levels to avoid complications in the infant. After pregnancy, 5 to 10% of women with gestational diabetes are found to have type 2 diabetes mellitus. Women who have had gestational diabetes, okay, have a 20 to 50% chance of developing diabetes in the next 5 to 10 years of the history. Okay, this is what about gestational diabetes. This is not actually a pure type of a diabetes. It is actually a form of a glucose intolerance condition. Okay, now we'll discuss the next one, that is other types of diabetes mellitus. These topics and all are, there is no much importance. They are all also having the same problems of symptoms, characterizational related to type 1 and type 2 diabetes mellitus. Okay, anyhow, we'll discuss it. Other specific types of diabetes result from specific genetic conditions such as maturity onset diabetes of youth called MODY, surgery, drugs, malnutrition, infection, and other illness. Okay, these type of diabetes may account for 1 to 3% of all the diagnostic cases of a diabetes mellitus. Okay, in which LADA, LADA is the most famous one, which is familiarly known as latent autoimmune diabetes in adults. Okay, it is a form of autoimmune type 1 diabetes which is diagnosed in individuals who are older than the usual age of onset of diabetes mellitus. Usually this disease will happen when they are older than 25 years old or above. Okay, right. That's why it is said to be latent autoimmune diabetes in adults. Okay, right. Then alternate terms that have been used for LADA include latent onset autoimmune diabetes of adulthood or slow onset type 1 diabetes. Sometimes it is also known as type 1.5. Okay. Now we will discuss the important topic, diagnosis of diabetes mellitus. This is most important one. How can we diagnose an individual with the diabetes? Okay, right. In biochemistry, there are 3 different parameters are mainly targeted to diagnose diabetes mellitus. That includes glycosylated hemoglobin, fasting plasma glucose level, and oral glucose tolerance test. Okay, first we'll discuss about a glycosylated hemoglobin. If the glycosylated hemoglobin level of an individual is nearly 5.7, the individual is said to be quite normal. Suppose if the level is between 5.7 to 6.4, that is called pre-diabetic condition. When the level is more than 6.5, the individual is said to be diabetic. Okay, this is about glycosylated hemoglobin, that is HbA1c. Second parameter is fasting plasma glucose level. That is, please make a note the condition, fasting blood glucose. Okay, this is not the postprandial. Okay, right. When the fasting plasma glucose level is lesser than 99 milligram per deciliter, it is called normal. Okay, and when the condition is between 100 to 125, the person is said to be pre-diabetic individual. That is, he is in the beginning stage of the diabetes. When it increases or when it is beyond 126 milligram per deciliter, the person is said to be diabetic. This is about the diagnosis of diabetes mellitus based on fasting plasma glucose. Then last one, oral glucose tolerance test. Okay, this will be practiced in the diagnostic laboratory by the professional technicians under the guidance of the medical physician. Okay, in this test, suppose if you are identified with a blood glucose level which is lesser than 139 milligram per deciliter after the specified time duration of oral glucose intake, you are said to be normal. Suppose if the level is higher than 140 to 199 milligram per deciliter, you are obviously said to be pre-diabetic individual. And if the level is higher than 200 milligram per deciliter after the specified duration, the individual may be called diabetic. Okay. Now we will discuss the management of diabetes practices. There are 3 different ways in which we can manage the diabetes. The first one is through diet and exercise system. Second one, oral hyperglycemic therapy. And the last one, insulin therapy. Okay, first we'll discuss everything. Some research studies have found that lifestyle changes can prevent or delay the onset of type 2 diabetes mellitus among adults. Lifestyle interventions included diet and moderate intensity physical activity. That is, walking for 2.5 hours in a week. Okay, right. Then in the diabetes prevention program, a large prevention study of people at high risk for diabetes, the development of diabetes was reduced to 58% over 3 years. In the diabetes prevention program, people are treated with the drug metformin reduced their risk of developing diabetes by 31% in 3 years. Treatment with metformin was most effective among younger, heavier people, that is those who are 25 to 40 years old. Okay, and sometimes if you are 50 to 80 pounds of overweight, Okay, you can be treated with the metformin tablet, there is no problem. Okay, and less effective, this drug is found to be less effective among older people. This drug metformin cannot be used for the treatment for diabetes in older people and those who are underweight. Okay, in such cases we cannot prescribe this drug. Other medication studies are ongoing. In addition to preventing progression to diabetes, both lifestyle changes and medication have also been shown to increase the probability of positive result. Okay, diet system is having an important role in the management of diabetes that should aim at ensuring weight control, providing nutritional requirements, allowing good glycemic control, and correcting any associated blood abnormalities. Okay, we have the huge list of common fruits that are found to be carbohydrate rich in nature. Okay, so these fruits cannot be taken by the diabetic individuals. So the ranking starts with grape, which has 18.1 gram of sugar in an 100 gram of fruit. Okay, followed by banana, mango, apple, pineapple, kiwi, pear, apricot, orange, etc. So in this order only, the fruits are found to contain more sugars. So the diabetic individual should avoid all these fruits. Okay, there are some fruits which may be identified as fruits with very low sugar. Okay, that includes grapefruit, Granite Smith apple, lemon, lime, kiwi, berries. Okay, these are all the major fruits. Okay, and even pear, apricot, star fruit, peaches. Okay, these are all found to be good for diabetic individuals. Okay, the percentage of fat and oil consumption should be reduced in the diet. At the same time, we should take off more fiber rich content foodstuffs, vegetables. Okay, right. Then there are some Indian herbals which are found to be effective against the diabetes. That includes cinnamon, ginger, turmeric, cloves, curry leaves, garlic, and fenugreek. These are found to be effective against diabetic mellitus. Physical activity promotes weight reduction and improves insulin sensitivity, that lowering blood glucose levels. Together with the dietary treatment, a program of regular physical activity and exercise should be considered for each person. People should have awareness about all these things, that is the importance of physical activity, okay, and the diet system in case of those who are trying to maintain and manage diabetes practices through lifestyle changes. Okay, actually the exercises helps to reduce blood glucose level and it improves the body's ability to use insulin. It reduces the insulin requirement, that is insulin therapy can be avoided if we do enough of physical activity. And better control of diabetes, we can manage diabetes simply with the help of physical activities, and it greatly reduces the risk of heart diseases and another major complication of diabetic individuals. Okay, there are some oral anti-diabetic drugs which have been characterized and available in the market. Okay, there are some different categories, that may be biguanide, insulin segregatase, and alpha glucosidase inhibitors, thiazolidinones. Okay, the example for such drugs includes metformin, climperide, glipizide, glyburide, okay, and even agarbose, meglitol. These are all the major oral hyperglycemic drugs that are available in the market, okay, which should be taken after the strict suggestion given by the respective medical physicians only. Okay, then self-care. We can manage this diabetic issue through self-awareness system. In that condition, the patient should be educated to practice self-care. This allows the patient to assume responsibility and control of his or her own diabetes management system. Self-care should include regular blood glucose monitoring, regular body weight monitoring, food care, personal hygiene, healthy lifestyle, regular physical activities, healthy diet system, and stopping the habit of smoking. So These are all the major lifestyle habits that are suggested for the individuals, those who wants to manage and treat diabetes mellitus. So this is about diabetes mellitus. Okay, students, so in this presentation we have discussed what is meant by diabetes mellitus and what are all the major symptoms of diabetes mellitus, different types of diabetes mellitus, major complications of diabetes mellitus, types of diabetes mellitus, pathogenesis of type 1 and type 2 diabetes mellitus, and the management and preventive systems available for the diabetic system. Okay, right. So you please prepare in this order for examination, and already I have shared the materials to you. Okay, we'll discuss some other topic in the next class in detail. Thank you so much.